Hi, I'm Chris Wood. I'm Director of Dental Implant Solutions. We have a practice that's purely focused on delivering dental implant treatments. We have a very professional team here who are focused on delivering excellent customer care and putting our patients at ease. It's very important to us that we communicate very clearly with our patients. We guide our patients through a structured treatment pathway, which begins with a thorough discussion about their treatment needs, some planning, a thorough examination of the situation, often with a CT scan, then comes a surgery, and then we follow up with very thorough aftercare advice. In this video, we'll be looking at two complex procedures. The first one is a weld-on same-day teeth. The second one is a Botis bone graft, and you can find both these procedures for reference on our channel. The first procedure is a same-day weld-on teeth procedure, where me and my team will remove a failing bridge, place the implants and fit the teeth in the same day. The benefits of the weld-on technique are that people don't have to wear a temporary denture, and people often don't like the discomfort a denture can cause, and also the treatment happens in one day, whereas normally it would take 6 to 8 months to get the same outcome. The planning involves using a CT scan, which is a three-dimensional X-ray of the patient's mouth, so we can very carefully plan the implant positions, ensure they have adequate bone for the treatment to work. The preliminary stages involve taking some impressions of the patient's mouth, so our technician can make a guide and a shell of teeth which we will use to fix onto the framework that's welded in the patient's mouth. The planning is so important in delivering the outcome that the patient wants. So the combination of a CT scan, the technical work, the technician being on site means we can predictably deliver exactly what the patient's looking for in the space of a day. The next procedure demonstrates a Botis bone block. These are techniques pioneered by Professor Bernd Giesenhagen. This is quite a unique technique that we use to build up patients' bone. People often present to us where they lost their teeth many years ago and they don't have adequate bone to have an implant solution. This allows us to rebuild the bone volume that's been lost predictably and effectively, and we're one of the few clinics that use this process in the country. The benefits of the Botis bone block procedure are that we can predictably build up bone volume and allow patients to have the treatment solutions that they're looking for. Using low-dose cone beam CT scanning, we can provide a 3D image of the patient's jaw. We can virtually place the implants into those images so that we can predictably build up the bone volume that we need to provide the implant treatment. And from that information, we can see exactly how much bone needs to be built up using the Botis bone block. Once the patient has the scan, we can present the findings to the patient, explain the process to them, and that helps them relax and understand the process that's involved. Both these treatment examples show how we're using the latest technology to plan the patient's treatment pathway and provide a predictable outcome both for our benefit and for the patient's benefit. Make sure you watch the other videos on our channel to see these new techniques put into practice.